There's an outstanding event in the PD area at Francis Marion University. We'll tell you all about it coming up next on Carolina People. Good morning. Welcome to Carolina People. This morning we're at Carolina's hospital system. We're in the city of Florence, and we're focused on the PD area Heart Walk coming up on October 26th at Francis Marion University. We're visiting with Barbara Garrick. Barbara is the program director for cardiac and pulmonary rehabilitation here at Carolina's hospital system. Barbara, thanks so much for being with us this morning.
Thank you.
Are you a PD area native, Barbara?
Well, actually I am.
You're from the city of Florence, or from...
Well, actually I came from Williamsburg County, Kingstree. I've been over here about 20 years.
Oh, yeah. Well, then you're intimately involved with a lot of activities going on in the PD. Are there other charities that you support other than the Heart Association?
Well, the United Way.
Mm-hmm. Carolina's hospital system has been so gracious this week, obviously, to open up the doors to enable us to tape here. I know Carolina's hospital is a corporate sponsor, yes, as well as getting a heck of a lot of team walkers out there supporting. You've got myriad teams within the hospital.
Yes, we do.
Do you have any idea about how many teams you've got?
I'd have to stop and think. I have 5 recruitment leaders,
okay,
and then they recruited team leaders, and then those team leaders recruit walkers. So it just goes right on down.
So it ripples on down,
yes,
as a pyramid. Very well. What is your responsibility within the hospital?
My job you're talking about?
Yes.
As the director of cardiac and pulmonary rehab?
Mm-hmm.
Well, I'm the director of those 2 programs and make sure that the patients are safe while they're there, and that everything runs smoothly.
What would be a normal head count of patients that would be in, let's say, today here at the hospital in those 2 programs?
We're seeing anywhere from 120 to 140 patients a day.
Is that right? Mm-hmm. That have been affected by cardiac or pulmonary?
Exactly.
Son of a gun. Well, the PD area division of the American Heart Association has such a focus on heart disease and stroke, and reinvesting these funds back into the community after an event like the Heart Walk. I think the entire goal for this walk is $275,000.
Yes.
Of which getting the walkers out, you know, as Andy Evans was on talking about TRICARE, Blue Cross Blue Shield, and their involvement with the walk. And the goal of getting the walkers out, each walker is a goal, I think, expectedly around $100.
Correct.
And so if you're getting, let's say, 300 walkers out or 200 walkers out, really the goal's a heck of a lot easier to reach. Do you know what Carolina's hospital system's goal is?
17,000.
17,000. Do you have any idea how they're headed towards the goal? Or are they doing pretty well on that?
Well, I think so. We just had our kickoff campaign last week, where we actually started, promoting it, and there's a lot of the hospital is providing incentives,
yes,
for people that raise so much money. There's also some competition that's going on between the different
sure,
departments.
Yeah.
The department that raises the most money is getting a meal out on the town.
Is that right?
Yeah, the 10 top producers are getting $50 Magnolia Mall gift certificates.
Those are some of the incentives you were
yes,
talking about. What are some of the other incentives?
Well, the Heart Association also has incentives, too, that they provide if you raise X amount of dollars, starting with a T-shirt and going right on up.
Is that right? I understand that you were part of the original organizers of the Heart Walk here in the PD. Was that
yes,
how many years ago?
12, I think.
What prompted you to get active 12 years ago?
I was in cardiac rehab.
Right.
We had just started our program then, and the work the Heart Association does is so beneficial to the patients that are in cardiac rehab that, I feel like that I need to support it.
And you're also involved in recruiting teams. How do you go about recruiting teams?
Well, you kind of look at people that have done similar things before that you know are good cheerleaders,
right,
and you try to get them on board to begin with.
Mm-hmm. That is a great goal, to get cheerleaders out there from whatever community it is. If you've got, do you know if there are other? Surely there are a lot of family members of staffers here at the hospital, other
yes,
medical.
Almost any of us probably know someone that been affected by heart disease or stroke. So when you think about that and you think about making a difference in people's lives, that's why you want to support the Heart Association.
What do you think makes the team so successful, or the teams here at Carolina's hospital system?
Well, the hospital's kind of, we're in the healthcare business.
Yes.
So if we can help reduce death and disability from heart disease, and that's the Heart Association's goal, then the hospital is behind it 100%.
Are there some activities that are going on currently within the hospital, some wraparound activities?
Oh, yes. Of course, we had the kickoff. We had a drinking booth. We sold cakes, raffle prizes. We sold, took donations for ice cream and cookies. We're heart healthy. The hospital also has their own Heart Walk T-shirt that we've designed.
Your own Heart Walk T-shirt, great.
So there's a donation of $12 for the T-shirt or $25 for a sweatshirt. And those go over real good toward helping us meet our goal. Yesterday we had a bake sale sponsored by the Cardiac and Pulmonary Rehab Department, and the patients actually did most of the baking for it, and we raised over $1,000.
Over $1,000 just yesterday?
Yesterday.
Son of a gun.
We have an Afghan that one of the patients have made that we're selling tickets, donations for. We also have a homemade porcelain doll that another patient has made. So,
sounds like your patients are really helping make these goals a reality.
Usually cardiac rehab is raises the most money in the department, in the whole hospital.
Sure.
So the other departments are kind of gunning for us this year to knock us off the pedestal.
What are some of the competitions going on between the departments?
Well, they're just out trying to raise more money so they can beat us.
Sure. Well, having your patients put together Afghans or baking brownies or even making ice cream to really make this happen is
great.
Is surely a helpful component there. When you think about all your years involved in helping organize the Heart Walk, when you think about all the 20 plus years in cardiovascular prevention, is there anything in particular that you would tell viewers to try to do to help prevent heart disease and stroke?
One thing is to live healthy. That means eating the right foods, not smoking, controlling the blood pressure, exercising.
Very definitely. Barbara Garrick, 20 years with Carolina's hospital system, originally from Kingstree, now here in the PD, and maintaining a great commitment to serve the American Heart Association here at this year's Heart Walk. October 26th, Francis Marion University. Look forward to seeing you out there on the 26th. Thank you for being with us, Barbara.
Thank you.
Stay tuned for more Carolina People coming up next. Good morning. Welcome to Carolina People. This morning we're at Carolina's hospital system here in the city of Florence. We're focused on the PD Area Heart Walk coming up on October 26th at Francis Marion University. And we're visiting with Jenny Reid. Jenny, thanks so much for being with us this morning.
You're welcome. Thanks for having us.
You're the area director for the PD Area Heart Walk?
That's correct.
How long have you been the director?
For a very short time. I've been with the Heart Association since December, actually. So okay. I'm fairly new to the organization, but very excited to be here.
Yes.
And we're right in the middle of the walk, so it's an exciting time to be at the Heart Association.
Very definitely. Are you a PD area native?
I am. Wasn't born here, actually. I moved here when I was 4, so I consider myself from the PD, from Florence.
Yes, and you said you've been with the Heart Association since December.
That's correct.
And your responsibilities are almost exclusively over the PD Area Heart Walk.
They are exclusively with the walk.
Okay, great. When we think about counties that are served by the PD Area Heart Walk, surely Florence and Darlington County come to mind. I think I understood that Dillon County has recently been added.
We have recently added Dillon. We have Florence, Darlington, Hartsville, the Lake City area. We are involved with the Marion County area.
Right.
And Dillon is new to the walk this year. We're excited to have them.
Does Marlboro County have a walk of their own?
Marlboro County does not have a walk.
So surely there are hopefully folks within Marlboro County who will have the opportunity to come down. Francis Marion's such an easy location. A couple weeks ago we did a focus on the Waccamaw Division's Heart Walk. Horry and Georgetown County, and surely the goal on October 19th is to get walkers from all over the area, all over our viewing area, whether they're in Columbus County or Robinson or Scotland County, to be able to come down and partake in an event to help raise funds. So many of those funds are kept in the community, whether in that instance in Horry and Georgetown, or in this instance in Florence and Darlington and in Dillon counties. But surely walkers can come up from Horry County or down from Robinson County to be there on October 26th?
Absolutely. We invite anyone who wants to participate in the walk to be part of it. We are always trying to expand the counties and the areas that we reach.
Great. If a viewer wanted to partake in the walk, is there anything they would need to do now? Is there a number they could call to get some information?
Certainly, they can call our office. They can form teams around their companies. They can form teams individually around friends and family, around a loved one even who has experienced heart disease or stroke. We have a lot of folks who form teams that way.
Right.
They can contact our office and we'll get with them, get all the information that they need to be successful.
What would be the best number for them to call, Jenny?
It would be area code 843-665-0985.
843-665-0985.
That's correct.
Okay, great. Had you been active in the Heart Association formerly as a volunteer before becoming an area director?
Yes, actually, I was a recruitment leader before I came to the Heart Association as a volunteer, and I helped form teams through McLeod Hospital. And during that time, actually, my father suffered a heart attack, and he is living in Massachusetts, so I rushed away to be with him. And when I came back, he is a survivor, I will add that. When I came back, I had more passion about what I was doing, and it meant more to me. I knew that the research, the funds that were collected from the Heart Walk went to the research that helped save his life. So that actually increased my interest in the Heart Association and their fundraising efforts.
Very definitely. A personal experience that prompted you to be even more actively involved, having formerly been and you said your father's a survivor?
He is.
He active with the Heart Association up there in Massachusetts?
He is actually in Massachusetts. He does a team every year. He's a red capper, so he gets out there and walks. Our red cappers are folks who have experienced heart disease or stroke or some sort of invasive procedure related to that, and that's who we walk for. That's who we raise money for. So he is involved in that way.
That's wonderful. What's your responsibility as director of the Heart Walk?
There are two ways that we raise money through the Heart Walk, through corporate sponsorship and through teams, which are actual walkers that come to the walk and raise the money. Mary Torgersen is in charge of corporate sponsorship, and I am in charge of the teams. So there are two ways that folks, like I said, organize teams, and that's through their companies, through businesses across the PD are involved in that way.
Right.
And then friends and family individually form teams around loved ones. In both of those ways, I organize that piece of the walk.
Great. So there are, when we've heard earlier this week about wraparound activities, what are some examples of wraparound activities that either a team could put together, or even as an individual? If you were an individual and we're going to be out there walking, could you have some activities on your own? What are some examples of wraparound?
That's a great way for companies and teams to increase their funds raised. They have special days they have at their offices. Casual day is an example. People buy a ticket to participate in casual day, and they can wear jeans on Friday. Bake sales they have in their companies, and different things like that. Companies come up with very creative ways to get their employees involved, and it maximizes the amount of money they're able to raise that way. People like to buy tickets and purchase some kind of experience. Right,
sure. Earlier this week we heard about hot dog sales. I think someone was talking about a CEO car wash, where a local CEO or the CEO of the company would come out and wash other folks' cars. So many activities. I think we heard about a basketball tournament.
Yes,
very popular.
Here, I think at Carolina's Hospital, they had a dunking booth for their CEO, and that went over real well. Folks came out and purchased a ticket to dunk the CEO, and so that's an exciting way for the employees to get involved.
I'm sure they would love that. Hopefully, that's a challenge to all CEOs throughout the community, the willingness to be dunked or to wash cars, any activity to get out there and give folks that you're asking to get out as team walkers or as individual walkers the day of the walk. October 26th is the date. Registration starts at 8:30. The walk will begin at 10. You can be out there to walk a mile or walk 3 miles or just be out there to cheer on the walkers. Jenny Reid's having so much to do with making this happen, and we appreciate your time and effort. Thanks so much for being with us this morning.
Thanks for having us. Thank you very much.
Stay tuned. We'll be right back with more Carolina People. Good morning. Welcome to Carolina People. This morning we're at Carolina's hospital system, the city of Florence. We're focused on the PD Area Heart Walk coming up on October 26th out at Francis Marion University. And we're visiting with Mary Torgersen. Mary's the PD Area Director of the Heart Association. Mary, thanks so much for being with us this morning.
Thank you, Greg.
And in that role as the Director for the Heart Association, I think the particular focus is on corporate sponsorships for both the Heart Walk and is there another event, the Heart Ball as well?
Yes, there is. Actually, I'm totally in charge of the gala, as we call it, our Heart Ball, but I'm just in charge of the corporate piece for the Heart Walk.
Okay, great. How long have you been with the Heart Association?
I'm just very new. I just came on board in July.
Okay, great. Are you from the area originally?
I am. I was born in Kingstree, so I've been in the South all my life.
Yes, you know the PD area well.
Yes.
Before your time at the Heart Association, do you mind me asking where you...
Sure. I was at House of Hope, which is another nonprofit here in our community. It's a homeless shelter for women and children. And I've pretty much been involved with nonprofits all my life.
It's my understanding that your involvement with the Heart Association has been something you'd had a particular interest for years. There's personal involvement, a personal experience that happened.
Yes. As a matter of fact, a year ago this month, my grandmother passed away, and she died of coronary heart disease.
Oh, boy.
So she was a real mentor for me.
Well, the personal involvement oftentimes is what prompts folks to get involved, whether it's with House of Hope or the March of Dimes. Surely the involvement with the Heart Association, the ability to keep funds and reinvest them back in the community.
Right.
As the Heart Association, I think Jenny Reid earlier may have pointed out, the Heart Association is not a recipient of United Way funds. They're not federal grants. They're not grants in the community. It is the private support of donors, whether it's in a corporate sponsorship level or team walkers. What exactly does it entail, the responsibilities of a corporate sponsor? How would that occur?
A corporate sponsor is just a business in the community that wants to be involved in a large way, and they give a gift that's usually a significant gift. But what that does, I think, Greg, in the community is it just tells the people of the community that they are concerned about our health and our welfare in this area. I spoke with one CEO and asked him why he was involved, and he just mentioned that, they're always looking at the bottom line, and medical costs are rising, insurance costs are rising. So by being a corporate sponsor, it's saying to their employees, we think this is important for you, for your lifestyle, good eating habits, good exercising habits, knowing the signs and symptoms of strokes. And that's going to help that corporate person. It's going to help their bottom line if their participants are actively doing good things.
Yes, very definitely. If a viewer was with a company that was not yet a corporate sponsor, but knew that they'd be interested in possibly doing something like that to keep the funds back in the community, how would they go about letting their company folks know about the Heart Walk and what they could do as a corporate sponsorship?
Actually, they could just call me at 843-665-0985, and just if they want to give me the name of who I need to talk to in that company, I'll be more than happy to call on them myself and take them the appropriate information.
Great. How many corporate sponsors are there now for the Heart Walk? Do you have any idea, or are there some financial goals that were set for corporate sponsorships? I think, Tom, you were earlier in the week, the chairman talked about an entire $275,000 goal. I think he pointed out about $60,000 of that would be derived, hopefully, from corporate sponsorships.
That's correct.
Is there has the goal been met yet?
No, it has not. We're at about 45,000, and I wouldn't know the total number of businesses that are involved in that, but I would say it's probably 15 or so.
A heck of a lot, yeah.
And so we're still looking for others.
There's room for more.
Yes.
You say the goal's 60,000, you're at 45,000 now, so there's still an opportunity. And obviously it gives folks not only within the community of that company, but also in the community writ large, the recognition that that company is interested in fighting heart disease, fighting strokes. Oftentimes when folks think about the American Heart Association, they just think about fighting heart disease, but strokes, a brain attack, has such a dramatic impact on people, the debilitating effect that a stroke could have if it's not detected virtually immediately is substantial. And so if a corporation in town, whether they have a personal involvement, like yourself, the loss of your grandmother, or if they just want to show that they're interested in fighting heart disease and stroke, the ability is there. And you said that number again is 843-665...
0985.
Okay, well, great. Well, hopefully, hopefully there's still some opportunity to get corporate sponsors out there. And surely the goal of $275,000 is a goal that is a very aggressive goal, but at the same time is one with former goals. I think last year I was told that $270,000 was raised.
Yeah, it's a very attainable goal.
Spectacular.
Yes.
Well, are there other events when we think real quick about the gala coming up? When is the gala to be held?
Actually, we've moved the gala this year, and it's going to be February the 15th in 2003.
Great.
And we are real excited about some changes that we're making there. We're going to have sit-down tables this year where everybody can have a designated place to sit, and that's been something in the past that people have said they really wanted. And so we're making some good changes this year.
It's February 15th?
Yes, it is.
It'll be held where?
Country Club of South Carolina.
Great. Okay. Well,
Love for you to come.
That's an easy location. Hopefully I can make it up. Very definitely. Are there some corporate sponsorship opportunities with the gala?
As well, yes. We have lots of wonderful opportunities for sponsors there.
And if folks want to learn about that, they could call you at that same number.
Sure.
Great. How about the day of the walk? You'll be out there,
yes,
obviously,
we will.
October 26th. Jenny Reid will be out there, I think Mona Carter, and all the folks associated with the Heart Association. Is there anything that goes on in particular that day with corporate sponsors? Any activities that those sponsors are involved in?
They have the opportunity to sponsor different things that we do that day. We have a children's corner. This is a family event. We encourage people to bring their children, so we like to have some fun things for them to do. We have sponsors for the parking lot. We have a starting line sponsor and a finish line sponsor, and there's a band sponsor, so they could put their banner up. They could have a booth out there that day to hand out, information about their company, or, just whatever would be good for them.
Right. We have less than a minute, Mary, but I was trying to think in particular when we think about the Heart Association, we hear about the money staying in the community. What directly does it do to impact the community?
Actually, the money goes, I just got a printout yesterday, and the Medical University of South Carolina, the University of South Carolina, and Clemson University are all three universities in this state that receive money from our grants. And these are for educational purposes, for new discoveries in the science of heart disease and stroke. And we're just very proud of the things that are coming on board as a result of what this research does.
Very definitely. Mary Torgersen recently came on board, PD Area Director of the Heart Association, in charge of corporate sponsorships, not only for the walk, but also for upcoming Heart Association events. We'll see her out there October 26th at Francis Marion University. Thanks so much for being with us this morning, Mary.
Thank you. My pleasure.
Stay tuned for more Carolina People coming up next. Thank you for joining us on Carolina People. If you need more information about the Heart Walk, please call 843-665-0985.